everybody. Today is Friday, March the 27th, and I am Dr. Valerie Cush, Chair of the Montgomery County Board of Commissioners. I am here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Dale. I'm also joined by Dr. Brenda Weiss, who is the Director of our Office of Public Health, and Dr. Alvin Wong, who's our Regional ENS Director. Hope everyone is doing well today. Since our March 26th press conference, we have had 58 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 371. These positive individuals are from 30 municipalities, 3 of which are reporting their first cases. They are Hatboro Borough, Southford Township, and West Pottsgrove Township. This brings us to 47 of our 62 municipalities that are home to individuals with COVID-19. These individuals in today's report range in age from 12 years old to 83 years old. And as always, you can check the map at our website, moncopa.org/COVID-19 for an updated list of the municipalities and the numbers of individuals that live in those municipalities who are positive. The age brackets for today's 58 individuals, there are 6 in the 10 to 19 years old bracket, 14 in the 20 to 29 group, 6 in the 30 to 39, 7 40 to 49, 10 50 to 59, 11 60 to 69, 3 70 to 79, and 1 80 to 89. We have 34 females and 24 males. 1 is hospitalized. 39 are not hospitalized and being monitored at home. And we have 18 that currently are unknown. I'm also saddened to confirm that a 4th Montgomery County resident has lost their life to COVID-19. This individual was a 95-year-old male who resided in Abington Township and was in a hospital at the time of his death. I have no other information about any underlying medical conditions. And of course, we continue to extend our deepest condolences from all of us here in our county family to the loved ones, friends, and family members of this individual. So just want to do a couple housekeeping things today on Friday. First, some reminders about how you can reach us and which numbers you should use for which things. So first, we have our public inquiry line and our COVID-19 email. Our public inquiry line is 610-631-3000, and our email is covid19@moncopa.org. This phone line and email address should be used for your general COVID-19 inquiries, such as testing site information, business closure information, ways to donate, and county services that are being provided during this time period. If you are a senior or have questions about supports for seniors and housing and veterans benefits, you should call our Navigants number, and that number is 610-278-3522. Now, for healthcare questions, you should definitely try to call your healthcare provider. I do want to remind everyone that we do not have any clinicians at our public information line. But I want everyone to be aware that almost every health insurance company in our region, in fact, I think all of them at this point, are providing telemedicine options, and you should definitely check in and see if that might be an option. I've also talked to a number of physician practices in our area that are doing phone consultations or telemedicine support from their offices. So please try not to call here with actual clinical questions, because we really don't have the staff available to answer those calls sufficiently. So try to get to your healthcare provider first. I want to also let you know that the Pennsylvania Department of Human Services has released guidelines to expand the use of telehealth for all healthcare providers, including behavioral health. Federal guidelines have also been released to support the expansion of telehealth, and those guidelines included anyone who's covered by Medicare. The Montgomery County Office of Managed Care Solutions has received approval for the purchase of technology equipment needed to expand telehealth capacity in our medical assistance behavioral health program. All of our core community behavioral health centers, student assistance programs, our mobile crisis unit, and our community-based programs and inpatient facilities are implementing or expanding their use of telehealth to ensure continuity of care. So please check with any of those providers if that's where you get your care right now. Even if they can't do it today, in the next, hopefully, week at most, they will be able to provide many of the services they typically provide using a telemedicine type approach. Also want to give you a couple of phone numbers. The Montgomery County Peer Support or Teen Talk Line both have services on by phone. I'm sorry. You can call for adults at 855-715-8255 or text them at 267-225-7785. And for teens, they can text 215-703-8411 or call 866-825-5856. And for our teens, there's also an email, and that email is teentalkline, all one word, teentalkline @accessservices.org. And the hours are Sunday through Saturday, 1 p.m. to 9 p.m. And then I also want to remind everyone of our mobile crisis line, which is available 24/7. These are for any individuals or families that are experiencing any type of mental or behavioral health crisis. And the mobile crisis number is 855-634-4673. Now, a couple of updates on our community-based testing site. Our site continues to go well. I want to thank again Temple, Ambler, Upper Dublin Township, and especially our Pennsylvania National Guard Medical Unit. They're going to be transitioning out this weekend and will be replaced by a different team, but we want to really thank them for helping us. They provided a tremendous service over these last number of days. And of course, to all of our county departments that are assisting on the site. So let me give you some updates as we go into the second week of our site. The site will be open 10 a.m. to 4 p.m. each day except Sunday, and this will all hold for at least the next week. Registrations for appointments is changing. We are now going to open up registrations for appointments at 8 a.m. the morning, that morning for that day. So for instance, tomorrow, Saturday, at 8 a.m. tomorrow morning, you can get online or you can call our number and register for a test tomorrow, okay? Just a reminder, you can go online at montcopa.org/COVID-19, click on the button that says County Testing Information, and then just follow the directions on the registration form. You can also call 610-631-3000. Now, once all the appointments are full for that day, the folks on the phone will not give you an appointment, and the testing site website is going to say, the appointment webpage is going to say that all the appointments are taken for that day. And so if you see that, then next morning at 8 a.m., except for Sunday, you can try again to get an appointment for that day. Please, and we know things come up, but please try to only register for a test if you meet the criteria and you're available that day to come and get your test. We have had an average cancellation rate of about almost 28% during the first week of operations. That's a lot, and there are so many people that want and need to be tested. So please, only make an appointment if you're pretty sure you can get there that day. If you do have to cancel, we totally understand. If you could call us at 610-631-3000 and just let us know that you need to cancel, and we can help you get rescheduled. When you sign up online or by phone, the computer is going to automatically assign you a 1-hour window for testing that day. You cannot choose your assigned time for that day. So particularly if you're doing this online, make sure you can come when it is giving you that appointment. If you can't, just log out, maybe wait 15 minutes and log back in, and then you'll have a time later in the day. If you register and you're given an appointment time during the day, something comes up and you can't get to that exact time, but you can still come later in the day, if you arrive on site by 3:45, we should still be able to accommodate you, but we can't accommodate you if you were scheduled for a different day and just show up. There are a limited number of testing spots each day, and they will be given out on a first-come, first-served basis. And the other important thing to know is that registrations are made on a per-person basis. So if you make an appointment for yourself, but you show up with 3 people in your car, you're going to be the only person that gets tested. Each person that needs a test needs to register individually. The reason we do that is because when you register, you're given a barcode, and that barcode is how we track you through the system and how we make sure that you actually get your test result. No barcode, no test result, all right? So each person has to register. And if at all possible, drive yourself to the test site if you can, if you're able, to limit the risk of exposure to others. You do not have to get out of your car at the test site. This is set up so you just stay in your car and drive through. We don't want anybody getting out of their car. And when you come to the test site, bring your confirmation, print it out if you're able, but it's no problem if you just have it on your phone. If you have insurance, please bring your insurance card. I do want to reiterate, no insurance required. You will not be charged if you do not have insurance. And if you have insurance, you will not be charged a copay. And bring photo identification. So we will continue to run our testing site for as long as we have the staff and the supplies and the testing capabilities to do this. We still have limits on the number of tests available. And as long as that is the case, we are going to continue to ask generally healthy individuals who have mild symptoms that they're able to manage at home easily and no underlying medical conditions to stay at home. You do not need to be tested at this point. So we are coming to the end of the 3rd week here in Montgomery County since we have had positive patients identified living in our community. It's hard to believe that it's only been 3 weeks. It feels more like 3 months to me and to all of our staff here, but it's just been 3 weeks. And I want to thank everybody in this community who is part of the solution to COVID-19. First, to our healthcare workers, our hospital teams, our first responders and paramedics, our grocery store and pharmacy workers, and all of the people that help keep those places supplied. Our nursing home workers, and to all of our many county employees and so many others who work in essential businesses and services, thank you, thank you, thank you. Everybody in our community is depending on you. Second, I want to thank everyone who is heeding the call and staying home and strictly practicing social distancing when you are outside exercising. You are part of the solution. You are making sure that this pandemic ends as quickly as possible, and every one of us owes you a debt of gratitude for following the rules. And finally, to those of you who are not staying home and should be, those of you that are congregating in groups outside of your household contacts when you go outside, those of you that are not following these rules, you need to stay at home. And you need to acknowledge that every one of you that is breaking these rules for social distancing is increasing the chances that this pandemic lasts longer. Please, for the sake of all of us, for the sake of your parents and grandparents, for the sake of people who have underlying medical conditions or who are immunocompromised, you might be able to go out and be just fine through this, but you could literally be contributing to the loss of life from those other groups of people in our community. So please stay home. The sooner everybody stays home and complies with these rules, the sooner this thing ends. But when you go out and you allow this virus to spread, it may not make you sick, but it's going to make other people sick. It's going to increase the chances of our hospitals being overwhelmed. It's going to increase the chances that our first responders maybe won't be there as quickly as you'd like if you have a problem. It's going to increase the chance that somebody who's having a heart attack might not have a bed when they get to the hospital. Right now, we're managing all of that. But if too many people get sick, that is the kind of problems they're seeing in New York City. This is no longer some hypothetical thing in another country across the globe. This is happening in New York City, just a few minutes drive from here. You have to stay home. Period. All right, with that, I'm going to turn over to Commissioner Lawrence.
Okay, thank you. I want to give an update on our primary election. Today, Governor Wolf signed Senate Bill 422, which reschedules the 2020 primary election from April 28th to June 2nd and makes other election processes due to the COVID-19 emergency. And we want to thank all of our legislators and the governor for their swift action. I want to remind everyone that voters have the option to vote by a mail-in ballot rather than going to a polling place. And we are encouraging everyone to do that. If you've already applied to vote by mail, you do not need to file a new application. But if you want to apply to vote by mail, you can do so at www.votespa.com. And once again, we are encouraging everyone to use this mail-in option. If you are a Montgomery County resident and you have already applied for an absentee or mail-in ballot, and you've had to leave your address, for example, if you're a college student who is home now, you can contact the Office of Voter Services at 610-278-3275, and they will walk you through the process to change your address, make sure that you get your absentee ballot or your mail-in ballot. And this is for Montgomery County residents only. Other counties should call their voter services office. But once again, you do not need to reapply if you've already applied to vote by mail. But we are encouraging everyone to take advantage of this new opportunity to vote. The election on June 2nd will still be challenging for various circumstances. Yesterday I had the pleasure to announce the Montco PA COVID-19 Response Fund, which will support relief efforts to many of our nonprofit safety net providers in response to the COVID-19 outbreak. Our partners and funders have already generously contributed $250,000 to help meet the increased need for food and other crucial services. But more help is needed, and you can visit our website, www.montcopa.org/COVID, to both apply for grants up to $5,000 for safety net organizations and also to donate. I also want to announce that the PA Career Link in Montgomery County is extending its closure date with plans to reopen on Monday, April 13th. Workers who have been displaced can access free remote services, including workshops, training programs, and additional supports. And these free online workshops are available at www.pacareerlink.pa.gov. Earlier this week, I highlighted some of our local distillers who are providing hand sanitizer, and we want to acknowledge them again. We actually have a sign here for them. So if you do go out this weekend for essentials, you can stop by there. It's Boardroom Spirits, a distillery located on West 3rd Street in Lansdale. They are giving away 4 to 5 ounces to anyone who needs it. All they ask is that you bring your own container. The sanitizer is free, but they ask you to consider buying a bottle or two. And you can visit the Boardroom Spirits website at boardroomspirits.com for their hours. And then 2 great Norristown businesses, Five Saints Distilling and Crazy Aaron's Thinking Putty, have also teamed up to produce hand sanitizer. And for more information on getting hand sanitizer in Norristown, please call 610-784-0603 or email sanitizer@puttyworld.com. With that, I'll turn it over to Commissioner Gale.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gale. Obviously, this pandemic has been a tremendous disruption when it comes to scheduling. It has disrupted work schedules, family vacations, travel schedules, education schedules, not only children K-12, but higher education, our colleges and universities, our trade schools. It almost seems as if we hit a big, gigantic pause button on society. But today, I'd like to share some scheduling extensions that have been made that should help create a higher level of certainty for some people. So I'd like to share some deadlines of extensions that should be useful to the general public. Due to the COVID-19 pandemic and the national emergency declaration, states across the country have been temporarily closing or restricting access to DMVs. This precluded millions of people from applying for and receiving their real IDs. As such, the Department of Homeland Security is extending the Real ID enforcement deadline beyond the current October 1st, 2020 deadline. States have been given a 12-month delay so that the new deadline for Real ID enforcement is October 1st, 2021. The following professional and occupational license renewal deadlines will be extended. The State Board of Medicine has extended the graduate medical training license renewal deadline from June 30th, 2020 to September 28th, 2020. The State Board of Nursing has extended the registered nurse, clinical nurse specialist, and the certified registered nurse practitioner license renewal deadlines from April 30th, 2020 to July 29th, 2020. The practical nurse license renewal will be extended from June 30th, 2020 to September 28th, 2020. The State Board of Examiners of Nursing Home Administrators has extended nursing home administrator license renewal deadlines from June 30th, 2020 to September 28th, 2020. The State Board of Barber Examiners has extended barber license renewals from April 30th, 2020 to July 29th, 2020. I'm sure when all this quarantining is done, a lot of people will need some haircuts. The State Real Estate Commission has extended the renewal deadlines for all license types from May 31st, 2020 to August 29th, 2020. And lastly, the State Navigation Commission has extended its navigation pilot license renewal from May 1st, 2020 to July 30th, 2020. So as more deadlines of extensions become available, we will continue to update the public, again in an effort to create more certainty, because when all this is said and done, which everyone is looking forward to, reopening our businesses, reopening our schools, reopening all levels of education for licenses, as I just mentioned, will take a tremendous amount of effort and work, and it's important that we get some of the available deadlines out to the public now, so we can have a running start and get back to a sense of normalcy. So thank you very much, and I'll turn it back over to Commissioner Arthur.
All right, I do want to correct one piece of information I gave you earlier. The gentleman who deceased that we announced today lives in Cheltenham Township. Cheltenham Township. All right, I think that's all I have. Any questions? Todd, any questions from the press? Okay, great.
We have one question that was submitted by Carl Hessler from Pottstown Mercury. Earlier this week, the commissioner said that a correctional staff member did test positive for the virus and that live close contacts were identified, tested, and are in isolation. Have those test results come back, and if so, what were the results? Have there been any positive cases among inmates in the jail?
So I don't know if those test results are back yet. There have been no positive test results reported to me about any inmates or any of the individuals that were direct contacts of that original person. We have been seeing anywhere from 3 to 6 days to get test results back. So we can certainly follow up once we get those results back. Thank you.
Dr. Levine was asked this as well. The state numbers are slightly down from yesterday. Your number is slightly down from yesterday. Do you think that gives people false hope that these last 2 weeks, we need more than one down
We
day?
need more than one day. One day does not a trend make. So it's very nice to see that, but again, the way in which test results have been coming back has been a little bit sporadic. So we need to see a number of days in a row of the numbers coming down to really be able to say anything with any degree of scientific certainty.
Before the site in Ambler, you had another site here for testing for first responders because of potential exposure. Have all of those tests come back, and do we know if those first responders are now cleared and back on the job?
The site at Ambler has been our only site of testing in terms of any big groups of people, and they were actually tested the day before that we opened to the public. I don't know off the top of my head specifically of the positives that I've reported to you, whether any of those specific first responders were
I'm talking about the
positive or
site
not.
that was over here at the prison. It was very early on because of the potential exposure having to do with the multi-jurisdictional call.
Do you want to address that? Okay.
So the question was regarding the first responder test pod that we briefly operated here at the Public Safety EOC, and that was in response to one particular direct contact. So those results for the responder we tested are back, and there were one was positive out of that group that was not symptomatic, and contact tracing was completed for that. There were no further positive results from that cohort.
Great. Nothing? No.
I asked you, my last question, I asked you yesterday about the possibility of people in the general public who were concerned about masks for elderly relatives or those going through some sort of treatment. Is there any more information we can give them if they can get a hold of those for their loved ones?
So here is the progress that we made on that today. We have a weekly call with our faith community, and we get quite a few faith community leaders on that call. So today I asked them to pick a couple of people from that group that would be willing to come together and work with some technical support from the county government to create a community face mask exchange site. So it's not open yet. Hopefully we'll have that up by maybe first thing next week. And the goal would be that this could be a place where particularly all of these wonderful people in the community that are sewing masks could say, I have 6 masks to offer, or I have 10 or 12. And then people could come onto that site and say, hey, I need masks. And that we could get those people together. Because what we're seeing is a lot of people who are making masks, cloth masks, which is great, but no easy way to get them to the people that could benefit from them. So we currently don't have enough medical grade masks to give to people in the community individually. But the cloth masks can really be quite helpful. And particularly if it's a matter of somebody that's traveling to a doctor's appointment or chemotherapy appointment, something like that, having that cloth mask on will protect them if somebody gets, close to them, maybe nearby, that's coughing, particularly if they're at least 6 feet away. That should confer some protection for them, while we continue to reserve our medical quality masks for the paramedics and the hospital workers that really do need them the most, that are up close with people that are ill and can't maintain that social distance. So we're going to try to put our faith community, who's just itching to help, and they've been so great, together with the community to try to get that happening. So we'll keep you posted as soon as that is a live thing. Okay. We're not planning to do anything live over the weekend. We will issue press releases as with our daily updates, and we will plan to be back here in person on Monday at 3. It's going to rain this weekend. No one is happier than me that it's going to be raining this weekend, because that means all of you should stay inside. So please do that. Have a safe weekend. Maybe you can get out for a short walk, but please do not go out and congregate with any people that are not part of your household contacts, and have a safe weekend. Thanks, everybody.